Hello, I am spine specialist Dr. Sangho Lee. I have a sad story. 18 years ago, my mom had the surgery to fix her L4, 5, 6 with 6 screws. Over 3 years ago, when the days get colder, she suffers from pain and depression, so she was taking antidepressant. This year, she was treated with injection, painkillers and acupuncture due to the severe pain. Doesn't help. She had no choice but to take an MRI that she had stenosis and the nerves were narrowed by compressing. When I checked, surgery was impossible. It requires to add screws and it seemed a major surgery. I asked a doctor and he said that neural pathway can be secured by removing the tissue. I wonder if it's the best way. I think the spine cannot bear weight and may collapse again even if the space is secured with grinding the bones. It is hard to accept this surgery. It's frustrating. It's really frustrating story. There are many stories like this not only in Korea but also in many countries. More than 10 years ago, spinal fusion surgery to cut the bones and fix them with 6 screws has been widely performed to treat spinal stenosis, lumbar disc herniation, spondylolisthesis and spinal instability. Those were done a lot 18 years ago. It was 1985, so that surgery done almost 30 years ago. This surgical method has become the standard approach and is included in textbooks. This screw fixation still being performed in university hospital and general hospital. However, out of 100 people, 10 years later of this surgery, some patients return to me only after 5 years. About 25% of patients experience the development of a new spinal stenosis above the untreated area. Try tying 3 of your fingers. It's fixed, but you can't help but move. There is more movement L3, 4, which can lead to rotation. This may cause spinal stenosis to recur in about 25% of cases. However, patients are aged. Cutting bone and screw again, pain from previous surgery, she can't do it again, but I found out a way. There are 2 main ways. For spinal stenosis in 25% caused by after effects of surgery on L3, 4, it does not cut the bone. It goes between the bones so it doesn't cut the lumbar vertebrae. If the surgeon cut the bone and fix it with screws, there may be another problem, then the patient has to do the second and third surgeries. So it's done by going between bones without cutting the bones at all. What is the main cause of spinal stenosis? It's because of the thickened ligament, which should be as thin as paper. And the ligaments become thicker, resulting in stenosis. After removing only this bad ligament, a new artificial ligament is replaced. It is produced in France. It's solid and firm ligament that lasts a lifetime. This artificial ligament is a string. Strings like this. It's soft because it's not metal. It's a soft band. Try tying your fingers with a string. It doesn't move very well. Even if you only tie it with a string, it is well fixed. It even allows a little activity. Since the patient is free enough to move, it's different from screw insertion. So there is no spinal stenosis again. When you have spinal stenosis as an after effect of screw fixation done 10 or 15 years ago, try not to have fusion surgery with screw fixation. It is recommended to remove bad ligament through the approach between the bones and fix it with an artificial ligament. Then it will get better and all the symptoms of pain or numbness will disappear. This is a method that has been proven safe and effective for patients. Thank you.